Good evening, my dear students. I am your Dr. Ananyalakshmi. I am here with new topic for the day from Community Medicine, the continuation part of screening chapter, the criteria for screening. So in the previous classes, you studied what is screening, what are the differences between screening test, diagnostic test, uses of screening, and you also studied different types of screening. Now let's go into criteria for screening. If you are considering screening, there are two important criteria to be remembered. One is the disease criteria, another is the screening test criteria. Mean to say, how should be the disease to be applied for screening and how should be the test to be considered for screening. So first let me tell you what are the disease criteria to be considered. See, the disease should be important health problem. For example, it should have very high prevalence. The best example here is tuberculosis. So if you know that tuberculosis is a very important health problem and it is highly prevalent as well. So you can consider tuberculosis for screening as a disease. Disease should have long and detectable preclinical stage. Mean to say that it shouldn't have got serious manifestation at once. Instead, it should have some clinical stage which is actually long and sufficient enough to apply the screening test. For example, if you consider TB again, you know that there will be cough for more than 2 weeks, sputum for more than 2 weeks, hemoptysis, chest pain, loss of body weight, loss of appetite and many other features which will be there for quite long time, not just in few hours or days. So it has got long and detectable preclinical stage. Also, before the manifestation of this cough, sputum and all, it has got a long detectable preclinical stage which can be helpful to consider it for screening. Next one. The natural history of disease should be adequately understood. The natural history of the disease shouldn't be incomplete. You know what is natural history by now. That is, there are three things: agent, host, environment. You should know what are the features of each thing, and you should also know what happens in pre-pathogenesis stage, pathogenesis stage and post-pathogenesis stage for a particular disease. When you know most of it, you can consider that particular disease for screening. Then, appropriate test must be available for early detection of disease. So it is not just enough if it has got long and detectable preclinical stage, or it is not just enough if it is an important health problem. Or you might also be knowing what is its natural history in detail, but if it is not having any appropriate test which can be used as screening test, it will not be considered for screening. So facilities must be available for diagnosis of the disease. See, what will you do by knowing if someone has got the disease in an early stage or not? If you know they have got disease in early stage, definitely it will help for you to initiate the treatment early. That's why you should consider the disease which has got good treatment modality for screening. Okay, so there are some more disease features. Let us see. Early detection of disease and treatment should be able to reduce mortality and morbidity. So your main focus is on bringing down deaths and bringing down sufferings. So the early detection of disease and early initiation of treatment should help you to bring down the numbers of deaths and bring down the numbers of suffering. Then you can apply it. Then the disease should be treatable and there should be recognized treatment for lesions identified following screening. As I have already told you, if there is treatment, it is good you consider it for screening. Expected benefits must exceed risks and costs. So when you are applying a screening test, the screening test should not be more costlier than the expected benefits of it. Okay, so if you are simply screening one disease to do some study, it is not accepted. You should see to it that when you do cost benefit analysis, it should be cost benefit. Okay, and you should be also knowing that the expected benefits must exceed risks and costs. A policy should be agreed on concerning whom to treat as patient. So you should frame it before considering the disease for screening. So these are the disease considerations. Now let's see what are the test considerations. See, There are 5 important test considerations which you have to remember. It should be inexpensive, or it should be having low cost. Then it should be easy to apply. That is what it means. It should be simple test. It should not be very complicated test. For example, if you have to do FBS to screen for diabetes, it is very problematic. Why? Because we don't know, we cannot make sure whether the people have gone for screening for 8 hours and all when you do it in a large number of population. Okay, so it should be easy to apply. Instead you can do RBS testing like that. Then it should be acceptable by the people whom you are considering for the testing. See, it shouldn't be cumbersome, it shouldn't be embarrassing for the patient in whom you are doing this testing. It should be valid, it should be reliable, and it should have good yield. So if you have these 5 features, then you can consider the particular test as a screening test. So it should be inexpensive and easy to apply, which means that the test should be having simplicity. It should be acceptable, it should be valid, reliable, and also it should produce good yield. Let me explain the last 3 things now. So 2 important features, validity and reliability. So what do you mean by validity? Validity means the accuracy, means how close is result of a test to its true value. So this is what is validity. Is the test which you are doing is able to find out something accurately? That is what you mean by validity. Second thing is reliable. Now what do you mean by reliability? Precision. What do you mean by this? How close are the results of a test on repetition? See, when you do a test here, you think that you are doing blood sugar levels. You think that here it is 200. When somebody else do it in the same time in a different, when it is done by a different person, it shows some 400. Then the test is not valid. It means that when you do it repeatedly, the result should be shown same. Then only you can call the test as reliable. But to make it reliable, there are many features which come into which mainly hamper the reliability. I can give you the example of intra-observers variation, inter-observers variation, or there is some instrumental errors which are going to make the test less reliable. So I check BP, I thought it is 120/80, and you check BP in the same person and you get it as 130/90. So there can be subject variation or observers variation. So this is actually the point which brings down reliability of any test. But when it comes to validity, you have 3 important things which needs to be remembered. Sensitivity, nothing but what is true positive. Specificity, nothing but true negative. And predictive value for positive and predictive value for negative. Of course, you have another 2 things, false negative and false positive. But those things we will continue it with the next class. So 2 important features are validity and reliability. So the last thing which I was mentioning in the criteria for screening under test is yield. Yield means it should be able to identify new cases. The test should be able to identify new cases. It should yield new cases. Then only you can consider it as screening test. So finally, the small summary goes like this. The criteria for screening are mainly 2: disease criteria and screening test criteria. Disease should be more prevalent, it should have some treatment modality, there should be a long latent period, there should be easy identifying test which is available, and it goes on. Screening test criteria are mainly, it should be simple to be done, it should be valid, it should be reliable, it should have good yield, and of course it should be acceptable to the person whom you are going to apply it. So that's all about criteria for screening. Thank you.